Hi, this is Jason. Gluten sensitivity and lactose intolerance are two distinct digestive issues that can cause discomfort in people who have them. Gluten sensitivity, also known as non-celiac gluten sensitivity, NCGS, is a condition in which a person experiences symptoms similar to celiac disease, an autoimmune disorder that damages the small intestine in response to gluten, but without the presence of celiac disease or a wheat allergy. Common symptoms of gluten sensitivity include abdominal pain, bloating, diarrhea, and constipation. Gluten is a protein that is found in grains such as wheat, barley, and rye. These grains are commonly used in many types of food products, including bread, pasta, cereals, baked goods, and even some sauces and condiments. Lactose intolerance, on the other hand, is the inability to digest lactose, a type of sugar found in milk and dairy products. People with lactose intolerance lack the enzyme lactase, which is necessary to break down lactose. Common symptoms of lactose intolerance include abdominal pain, bloating, gas, and diarrhea. It's possible for someone to have both gluten sensitivity and lactose intolerance, and in such cases, it's important for them to avoid both gluten and lactose in their diet to manage their symptoms. If you think you may have one or both of these conditions, I would recommend seeing a doctor for a proper diagnosis and treatment plan. Please share this video with your loved one.